6th, House Healthcare, and this morning we're doing a drive through.
Bye.
We try not to use that in this committee.
Nice.
Of a bill that's in commerce right now on DFR. So let's start with our legislative counsel, and she can walk through what might cross our interest of our committee.
Good morning, Jen Carby from the Office of Legislative Counsel. So we are going to be looking at some language that is not, as I understand it, currently in H-137 as it is in the Commerce, as that bill is in the Commerce Committee, although I've been in there a few times on this language and it may end up in there. But H-137 is what often I think is referred to as the DFR housekeeping bill. It's the some changes proposed by the Department of Financial Regulation, and this one is not originating with them, but has involved them in the development. And so I think what maybe makes sense a little bit before we look at the language itself is to look at the existing law in this area, because it's an area we do not spend a lot of time in this committee. And so we are talking about Medicare supplemental, or it's really, I think, called Medicare supplement. So I'm changing that language in the bill. Medicare supplement health insurance. And so this is often referred to as Medigap. It goes along with a Medicare plan. It helps people with out-of-pocket costs associated with traditional Medicare. So under existing law, within 5 days after receiving a request for approval of a composite average rate increase, which is defined in here, in excess of 3% or other coverage changes that the Commissioner of the Department of Financial Regulation, DFR, determines will have a comparable impact on cost or availability of coverage for a Medicare supplement insurance policy issued by any of the types of insurers that offer plans in the state with 5,000 or more total lives in the Vermont supplement market. The Commissioner of DFR notifies the Department of Disabilities, Aging and Independent Living, DAIL, of the proposed premium increase. So under existing law, within 5 days of receiving a request for approval of a composite average rate increase of more than 3% offered by an insurer with more 5,000 or more total lives in the Vermont supplement market, DFR notifies DAIL. And this defines the composite average rate as the enrolled weighted average rate increase of all plans offered by a carrier. So there's lots of different Medigap plans, Medicare supplement plans, plan A, B, C, D, many letters of the alphabet. They're the contents of the plan, what's covered and how it works is defined by federal law. But some of the pieces we talked a little bit last week, some of the pieces around how it's implemented, states can have some role in. And so a composite average rate is the average rate increase of all of the Plan A, Plan B, whichever of those letter plans the carrier is offering in Vermont, and enrollment weighted average. So based on how many people are enrolled in Vermont in each one, we're looking at the average increase across all of that insurer's plans. So when that triggers this, under current law, 3% rate increase, and there's at least 5,000 lives in Vermont that would be affected, there's this whole additional process that occurs. So then DAIL notifies the DAIL Advisory Board, and some of this is going to stay in the bill we're going to look at, or the language we're going to look at, but I think it's helpful to understand what stays and what goes. So there's some information, some language about the commissioner not approving a rate increase unless it complies with statutory standards under rate review and under the different types of insurers that we're talking about. But the part I wanted you to particularly see, because this is what is changing in the language. So there is, if that 3% and 5,000 covered lives kind of trigger is hit, then there is a separate and independent expert review done that DAIL coordinates to do an actuarial analysis. And then we've got the two different actuary is the one that the department contracts with, and the one that the DFR contracts with, and the one that Dale contracts with, and there's hearings and a whole process. So that is what is being proposed to go away. That whole additional process, and I think you're going to hear from DFR, but my understanding from them is actuarial science is a science for a reason, and so the actuaries typically don't differ much, if at all. And so there's a lot of additional process and timing that gets implicated. So that's really where this proposal came from, is some experiences that people were, members were familiar with, where rates were not, or rate information was not known at the time that it would have been important to make a decision about whether to pick up or change a plan. So now let's look at the proposed language.
Can I ask a question real quick? Does every single insurer who has a Medigap plan that's offered to a Vermonter have to do this, or is it only insurance companies that are like licensed in the state of Vermont? I mean, I guess what I'm talking about is it just Blue Cross Blue Shield, or is it all the, Bankers Life?
Well, there's a rate review for all plans that are offered in this state, but this additional step is only when that threshold is met. And you're going to hear from DFR, I think. So Mary can answer your who does this apply to and how does it work? All right, let me put up the language that we're looking at. All right, so this was amending that statute that we were just looking at. And the first thing it's doing is changing the term to be Medicare supplement insurance. And I've added into the section heading rate review, because there's two different statutes on Medicare supplement insurance in this chapter, and it's confusing about what's what. So this would at least indicate that this one is on rate review. So this would add new language saying that within 5 business days after receiving any request to increase the premium rate for a Medicare supplement insurance policy from the same insurer types, from the insurer issuing the policy. So any request, the department shall post information about the rate filing on the department's website, including the name of the insurer requesting the rate increase, that overall composite average rate increase requested, the increase requested by plan type, the date on which the proposed increase would take effect, the system for electronic rate and form filing, the SERF, tracking number associated with the filing, and a web address for accessing the filing electronically, and instructions for submitting public comments and the deadline for doing so. So that's a new requirement. A lot of that information is already available. It's just not necessarily as easy to find. So this is.
Okay, Leslie?
So just so I understand, Jen, thank you. So this language is being added to what's already established, which means that Dale is still going to be involved.
Stay tuned.
Stay tuned. Thank you.
We're not done yet.
Okay.
Much more to come.
Yeah, that was,
All right.
appreciate it.
So then in what was an existing law, subsection A would now become subsection B. This would just add business days. So we're using 5 business days throughout. Within 5 business days after, just clearer than of, receiving a request for approval of any composite average rate increase in excess of, and now we're moving from a 3%, which is the current trigger, to a 10%. Those of you familiar with rate increases know 3% is pretty low for rate increases in the
These days.
yes, these days.
Modern times.
So we're increasing the trigger from 3% to 10%. And then the rest of it is just some cleanup language. And now this would still have the commissioner of DFR notify Dale. It would also have them notify the Office of the Healthcare Advocate of the proposed premium rate increase. So keeping Dale so far, within 5, again, business days after receiving that notification, Dale would still inform the members of the Dale Advisory Board of the proposed premium increase. And then most of the rest of this is the same in here about the commissioner not approving any rate request that doesn't comply with statutory standards for approval, and making such examination as the commissioner deems necessary. But it's now taking out this additional review. So taking out the reference to the additional review and the additional review itself. So now we do not have an independent expert's recommended composite average rate increase in addition to the department's actuaries' recommended composite average rate increase. So we're not looking at different actuaries on the state government side. You've still got whatever the insurer is proposing and whatever the state's contracted actuary is looking at. But we're not having a whole additional third Dale-led process. So that is what gets struck out. And instead, we would say for any filing by a health insurance company, hospital or medical service organization, or health maintenance organization, so the same insurers with 5,000 or more total lives in the Vermont Medicare supplement insurance market in which the requested composite average rate increase exceeds 10%. So now here's our different process that's going to happen if it's a higher rate increase. The commissioner shall solicit public comment and shall hold a public hearing in accordance with DFR's applicable rules regarding administrative procedures if not later than 30 days after that rate filing information that was added at the beginning of the section is posted. A hearing is requested by Dale, by the Office of the Healthcare Advocate, or by not fewer than 25 policyholders whose premium rates would be affected by the requested rate increase. So now instead of having this parallel Dale independent actuary process, we're instead having required public comment, and public hearing is required if it's requested by Dale, by the Office of the Healthcare Advocate, or by at least 25 policyholders.
So with all of them or, right?
Sorry?
The ones that request. They all don't have to.
No, it's an or, yes, sorry. Right. Yes, so here on line 8, or by not fewer than 25. So yes, any one of them can trigger a public hearing. And then in addition, for any filing that does not meet that criteria, the commissioner can still hold a public hearing in the commissioner's discretion. And in the commissioner's discretion, a hearing held under the subdivision 3 may be conducted remotely. This is really updating language in the existing law that refers to it being held by interactive television, which is yes, from a prior era. So this is also simplifying some language about allowing an intervention by any person that the commissioner determines will materially advance the interests of the individuals insured under the policy. It's similar to existing language. Non-proprietary relevant information is made available to the public upon request. We're just getting rid of this reference to the independent expert because they're not in there anymore. And then for Medicare supplement insurance plan, this is the timing with an effective date of January 1, which I believe is when a majority, but not all of them take effect. The insurer must file its premium rate request under this section not later than July 1st of the preceding year. So building in sort of a predictable time for the process. And for a plan with an effective date other than January 1st, it's still 6 months earlier, but we're getting a little less specific about the date because we don't know when this other date, effective date would be. Section, what I've called B for the moment, repeals the section in Title 33, where there's that independent analysis done by Dale or led by Dale. And then just the effective date section, I believe the rest of the underlying bill in Commerce takes effect on July 1st, but these provisions would take effect on January 1st. We just need to make sure we're coordinating that.
So having that July 1st date would allow any plan to go through all the process and be able to have the rate posted by open enrollment?
Yes, that's my understanding. And I think that was the intent. But I will let others who are more involved in the process.
I'm just curious, and you may not know this, but why does this sit in Dale? Well, because this is insurance stuff that I just didn't understand.
It is, but we're dealing with a population of 65 and older. And so it's the Department of Disabilities, Aging and Independent Living. And so there's a whole section in Title 33 on Medicare. Can't remember what the actual section is or chapter is called, but there's a chapter on Medicare advocacy program. And this is in that chapter.
Elderly, huh?
Aging.
Aging.
Are you,
Can I just remind,
yes, go ahead.
Mike Fisher, can I just remind the committee that the open enrollment period for this, in this case,
is that for a 6-month period after someone applies Part B, so there's not like a period of the year when everyone goes through open enrollment, it is case by case. So exactly how that date falls with an individual's need to shop for a product is a little bit more
Moving target.
moving terms.
Your birthday.
After you pass your 65th birthday and you go to Part B.
Yeah.
Any questions on the language for Jen?
So the notification, it's on the website. If I'm an individual living in Vermont, is that the only way I can find out about whether or not the rate's going to affect me?
Is the posting of these, okay, if I can look to the side, is this posting of the information on the requested rate increase on DFR's website the only way that a Vermonter with a Medigap plan would be informed that there was a rate increase requested?
I guess I'm not sure. I can't think of another way, but
I mean, you might hear about it from the insurer, but probably not when it's at the proposed stage, but just when it's at the,
Yeah.
when it's coming.
When it's
Yeah.
So that's,
So this, right, so this is actually, and I think having this information sort of prominently posted on DFR's website is more notice than people get currently.
Yeah.
There's a.
okay. All right, I just sometimes posting something on the website of some agency doesn't adhere itself to having real input from the people.
Right, well, they are, I mean, DFR is directed in here to solicit public comment. So that's toward the, and for, at least for a larger increase that affects a lot of people. There's that language about, on page 4, about the commissioner soliciting public comment. So what form that solicitation would take, I don't know, but that would be, again, reaching out to the public in a way that doesn't happen currently.
And put that together. Thank you very much, Jen.
Thanks, Mike, do you want to, oh, I'm sorry, our healthcare advocate.
Good morning, Mike Fisher, healthcare advocate. I can be very brief. I appreciate the member from Representative Marcotte and others for bringing this issue up. We have looked at this for years and years and cocked our heads and kind of gone, boy, this is old statute and doesn't make a lot of sense today. We have over the years made comment to a few times about Medicare supplemental increases. As you know, part of my team spends a great deal of time entering into cases around Medicare, around health insurance rate filings in the qualified health plans. In the qualified health plans and in the large group over at the Green Mountain Care Board. So I appreciate this change. We're in favor of this change. We think it moves it in the right direction. And I also just want to just very briefly recognize that there's something of a pattern of me coming to you and saying, hey, everything you know about the world of coverage for people not on Medicare. In recent years, it's been around Medicaid, under 65 and not disabled is different for those who are either over 65 or disabled. And so much like that whole discussion around Medicaid, there's a whole nother world of policy that we did not touch when we set up the exchange, that the federal government did not touch when it passed the Affordable Care Act. That is some old statutes. So I'm very brief at this moment just to say I appreciate this change. And I have gone ahead and asked to have posted the Act 99 report, which is old now, but it is a chunk of work that DFR engaged in because we asked them to around policies around this area, and so it's refreshed on your webpage, and I think there's a lot of really interesting information that's worth some time.
Any questions, Mike? I mean,
So as the healthcare advocate, I know you just said that you're comfortable with this. I just want to make sure, I want to hear from you that you feel very comfortable that Joe Sixpack is going to get the information they need if they happen to be if they wanted to be one of the 25.
No. I think the average Vermonter has a hard time and will have a hard time understanding what are the dynamics, what is the dynamics of the world of options they have for coverage, let alone what are the dynamics that lead to an insurance rate increase. I think the posting on SURF let me just say again, we do a lot of rate review. We are not looking to do more rate review work. The Healthcare Advocates Office is not looking to do more rate review work, though it is in our world of responsibilities to attend to it. But we do bump into, I'm not going to say Joe Sixpacks. We bump into regular Vermonters who really care about this stuff and do research and look at it themselves and plug in. It's not a lot of people, but it's not uncommon for someone to call us up and say, hey, this is going on in my rate, and they're informed and they want to know more. And so I think this will help. Maybe not your average Vermonter, but there are a set of Vermonters out there who I believe will attend to this.
any other questions for Mike? And you're good with the 10% going from 3 to 10?
I'm good with
That's
it.
a big jump.
It is a big jump. Leads me to want to say, let's remember the major factor that leads to rate increases is the cost of care. And, hugely. And so the dynamics that are leading to exorbitant increases in med sup rates in recent years are the exact same dynamics that are leading to big increases for our public employees, for our, for the other markets we talk about, and for Medicaid. I think it's all the same dynamic. It's the cost of care.
Thank you. Sarah, you want to come back? Sure.
Good morning. Sarah Luchout with Blue Cross and Blue Shield of Vermont. I have been working with everyone here in this room to modify the language, and we support the proposal that comes before you. It is a complicated process, and just to give you an example of what has happened, and the reason I think this came forward is we filed our rate request last year with the Department of Financial Regulation in June 15th, when people were going to buy their health insurance plans in October, November, there were no final rates. So they call us up and they say, we want to buy your plan. How much is it going to be next year? And we have to say, we don't know. So that's, I think, the main problem that this is trying to solve. The process is too complicated. It takes too long, and the rates are not available for consumers when they're going to make the purchase. So we do, you may not like the rate, but you need to know what it is. So that's in essence why we support the changes. So,
Great.
thank you.
Thank you.
Thank you.
Mary? Hi. Oh, remember ever seeing you in this
I have
committee?
never been in this committee.
Welcome.
Normally Emily is here.
Yes.
The deputy commissioner has taken advantage of the school vacation week. So I am here in her place. So Mary Black from the Department of Financial Regulation. As Sarah said, we all work together on this and support the change. It initially came out of the timing issue that Sarah identified. And while we were in there, we decided now was the time to make changes to the process to make it more effective, more streamlined, to change that percentage because it was unfortunately, given healthcare costs, way too low at this point. So we believe that these changes will allow us to streamline the process, but will still allow us to have an opportunity for public comment, to get to some of the questions around the public being able to comment. When we do have public comment, it's out on our website. We usually publish information around that, to say that there's a public comment period open to see if we can get, the public to make any comments they're interested in. During open enrollment, we get lots of questions from people, from Mike's office, from the SHIP, around these plans. So there are those consumers that will be paying attention. And we want to make sure that information is out there for them, but that we also have a streamlined process that will get their rates to them in the time that they need to make a decision about what they're going to do for the coming year. We are fully supportive and feel that we can make this work well for all of us.
Any questions? Leslie?
Do you work with the Council on Agents and how do you get the information to them?
So we push out information in whatever way we can think of. We usually do press releases. We, work with the SHIP.
What is the SHIP up there?
I can never remember what it stands for.
Did you say shifts?
SHIP. There you go.
State health improvement plan. I'm thinking about when I had to buy myself a laptop.
Right.
And it was torture. And I had to work with Senior Solutions, which is our local.
Yes.
And they were hugely helpful. So I just want to be sure. I'm unsure of how the information flow is. Is it passive in that we have to ask you, DFR or whatever, or is there more active outgoing to the people that may be helpful?
So we are in communication with all of those organizations around the state that provide seniors with information. We usually have meetings with them just before open enrollment season to talk about sort of what's happened and so forth. We answer questions sometimes as backup for them because they get overwhelmed at times. And so we'll wind up with questions into our consumer services area. So we make sure that they're informed to answer any inquiries. Even normally their job is to answer complaints, but they deal with consumer inquiries when, customers call in and they feel that they, need an answer to something and they don't know where to go. So we prep our team for answering those questions as well as making sure that all of the organizations around the state are aware of the changes that have been made and what's coming.
Mari?
The technical support the department would need for posting data on the website and for managing a public hearing, all of that. That you have the human resources to manage that. You don't need any extra help.
So we already have the ability to post to the website. We're working on making our website more user-friendly. So we're going to try to put this in a place that's easier to find. We do have a consumer services page, which is usually where we try to focus things like this, because that's hopefully the first place that people will go. We already are set up to do public hearings for this. It's just the trigger has changed. Right now it's at 3%, which is really low in this environment, unfortunately. So we're all set to, if we need to have a public hearing, we're prepared to do that and have done them in the past. So.
I don't know who can answer this question of all the people testifying. What's the again, I want to get back to the average Vermonter. I'm the average Vermonter. What's the process for me to become one of those 25 people in a public hearing if it takes place? What do I have to do? Is that going to be posted with on the website?
So we will solicit public comment on the website when we post the information about the particular filing.
Okay.
All they would need to do is write to us and say.
What does it say that?
Yeah, it will. Yeah, we will solicit comments from the public and say, right?
25 people.
We do. Yeah, we keep track of all of the inquiries and questions that we get from consumers.
Just want to make sure the answer is there. Okay, thank you.
And I'm sure if we had them, Mike would send them our way too.
A little bit of a confusion, correction. Yes, there is a state health insurance improvement plan. And there are also state health insurance assistance programs.
Right.
And that is the ship we're talking about here, and that's your AAA's.
Senior Solutions.
Senior Solutions, for instance. And I would think that that is also an on-the-ground entity that's helping people every day with
Mhm.
applying for Medicare. That would be a good way to get the word.
And you contact them.
We're in regular communication with them.
Okay.
Around, particularly around enrollment time to make because oftentimes, unfortunately, because seniors are faced with some expensive costs, they're getting overwhelmed at times. So we sometimes serve as the backup.
Woody, did you have a question?
Yes, where does the Green Mountain Care Board, where do they play a role in rate changes?
In this case, they do not. So these rate changes are handled by the department. Green Mountain Care Board handles rate changes for ACA. So major medical. So these are rate reviews that are done by the department itself.
Okay.
May I ask the member from visiting from Commerce, how your committee took testimony on this as well and in generally in favor? Did it, I know you haven't voted on anything, but
Representative Olson from Charlottesville and on the Commerce Committee. Yes, and the chair asked I just be here just to report back
okay,
to them on what you folks had come up with. I think there was general support for a measure of this sort.
Yeah.
And we heard testimony from the same individuals. Actually, maybe not Mary, but maybe it was Emily at that point. I can't remember. On this issue, we knew there was some need for some expediency, and we also knew that your committee was going to take it up. So we did not vote on it. We have a vehicle to consider putting this kind of measure into. We thought that it was going to be happen sooner, but it looks. I hate to make a prediction of these things, but I think it's going to happen later this week. So I expect, whatever you send back to that committee will be, considered for putting it in their paper.
okay, great. Thank you.
Thank you.
So I think we're just gonna do, does anyone have any other questions about this? I will say that I believe the impetus of this was that rates were public when people were in open enrollment. And yes, I understand that it doesn't get to the revolving people who are new, but for, yearly, when you're in open enrollment with your Medicare, you can, make determinations around your supplement plan. That the rates that were posted during open enrollment were not actually what the rate ended up being. And so people were choosing plans and then finding out months later that their plan actually was far more expensive than it was. So as I said, the impetus behind this was to try to streamline this process to ensure that consumers are getting accurate information when they're choosing their health insurance, accurate rate information.
I think the supplemental is not a yearly open enrollment. I think once you're in, and then you can change. Am I getting that right?
Change.
You can change, but then you lose access. It's a really complicated dynamic. You can't get back.
But if you're being given a rate for your current plan and you can make a change to something you feel better, it's probably consumer protection to ensure that the rate you're looking at is actually what the rate's going to be.
For sure.
So I think that we should just take a straw poll on this and then we can communicate to Committee on Commerce and right. So all in favor of this? And I have to count because I'm not sure, 902? Okay, 902. Representative Olson, would you like to report back to your committee, 902?
That's what I,
Okay, all right,
thank you.
thank you. Thank you. I know some people have to leave, but I think that our chief healthcare advocate wanted to just sort of talk generally about not this particular bill, but maybe some other challenges
Thank you.
that we might think about in the future.
Mike Fisher again. I want to do something a little bit awkward. I want to do something a little bit awkward. I want to tell you about areas of policy that I think are demand attention, and also suggest now it's not the right time to address them.
Great, so you're gonna both sign it.
Now, our insurance marketplace and the stressors on our healthcare financing system are such that now is not the right time to make the kinds of changes that I'm going to talk about. But I also want to let you know, much like the discussion about Medicaid for people who are over 65, that this committee, it took some great action on last year and is nibbling away on, I hope, this year to improve. Much like that, there's areas of policy for the insurance marketplace for people on Medicare that hasn't been looked at for a long time. And I appreciate that we and you just took the action on this narrow piece. But there's other related issues that I guess I just want to remind you of. There is always a balance point between protecting individuals as they move through the system and protecting the rates. We do things to say, we're not going to let people sit on the sideline and then buy insurance when they're sick. And so if we were going to be extreme in trying to protect the rates, we might say to somebody, hey, you get one time in your, the rest of your life when you can make this decision. I don't care if you live for 20 years more. You got to make this decision once. And we wouldn't think of doing that for the rest of the marketplace, but we do it here. Similarly, in the rest of the market, sort of the concept of taking the sickest people, the people who have the highest healthcare needs, and putting them in one single pool so that their rates are exorbitantly expensive to the point that we think that I think less than 10% of the people eligible for it actually buy a plan. The rest are bare. In order to protect the rest of the market, we just wouldn't think of doing that in the rest of the market. And yet we do it here. We pool the under 65, that is the disabled population, separate from the rest of the Medigap pool. And the sort of the fairness, sensibilities, and interest in not discriminating against people because they're disabled has me outraged about that kind of policy. For sure, if we addressed it, we would be raising the rates for the whole group in order to make it fairer, I think, for everybody. So those are just two examples. And I want to say again, I feel a little responsibility about this. I asked you in 2000, your committee, to ask for this report, the Act 99 report. And DFR put a lot of work into it, hired actuaries, hired a consultant to do. There was a great deal of work that went into creating this report. It's a good report. I don't believe it has ever been heard at a legislative committee. So I feel a responsibility that and it's just, I'll just admit, it's a little frustrating. I'm not upset with you. I was a chair once. I did the exact same thing. Part of our system, you guys are lay people doing your best to learn things. But I just wanted to state that a little bit, state that again, that And I know that you have some bills on your wall that address this area. There's a bill around annual open enrollment periods for Med Sup. I'm going to say again, I don't think this is the year. I happen to support some of that policy suggestions, but I don't think this is the year to do it. And I think it's some good evaluation of the pros and cons of those issues in this report that's now on the webpage.
Didn't we? Yeah, I know, I'm pushing back because didn't we hear about this report when we did a subsequent bill around Medicare supplemental?
It's possible I'm wrong. If I'm wrong, I'll admit it.
I did a bill.
Yeah,
I remember reporting a bill. I don't remember when it was.
I don't recall a time that the committee ever invited DFR to come in and walk through the report. And if I'm wrong, I'll apologize, but I was tracking it and
Did you want to ask your question real quick?
I noticed the first two recommendations are what I was just talking about.
Okay.
thank you.
Thanks. I think we're gonna take a break until 10 because 2, 3, 4, 5.